Hello, this is Sudharshan, and in this episode PH 1.31, we will talk about hypo-lipidemic drugs. So these are the class of medications which are used to treat hyperlipidemia when the blood lipids are more and also when there is increased serum cholesterol. So coming to the classification, it is divided into 7 parts. HMG-CoA reductase inhibitors or statins, fibrates, bile resins, triglyceride production and lipolysis inhibitors, then cholesterol absorption inhibitors, and other drugs like monoclonal antibodies and omega-3 fatty acids. So let us start with the drugs. We have first HMG-CoA reductase inhibitors, that is statins. So as the name suggests, there will be statin suffix for these drugs like lovastatin, pravastatin, atorvastatin, rosuvastatin, and simvastatin. And coming to atorvastatin, it has a trade name Lipitor, Lipitor. And the mechanism of action, it is in the name, that is, it blocks the enzyme HMG-CoA reductase that normally converts HMG-CoA to mevalonate. This is the rate limiting or intermediary step of cholesterol synthesis. And if we come to the side effects, for this we have a mnemonic, that is HMG. H is hepatotoxicity and headache. M is myopathy, that is muscle disease, and another one, that is rhabdomyolysis, where there is muscle breakdown. And G is gastrointestinal symptoms like abdominal pain, nausea, vomiting, and also it is known to cause a rash. And these drugs are contraindicated in pregnancy, and not only statins. Please remember, all the cholesterol lowering agents are contraindicated in pregnancy. And coming to the drug interactions, the statins will interact with mostly cyclosporin or erythromycin or azoles. It will also interact with grapefruit juice. This is another important point. Statins should not be taken with grapefruit juice. Statins are recommended to be taken in bedtime, because in bedtime more amount of the cholesterol will be made. And next, coming to the bile resins, there are 3 drugs, the mnemonic 3 C's: cholestyramine, cholestyramine, and colsevilam. And coming to the mechanism of action, as the name itself tells, it binds to bile and affect the enterohepatic circulation. And coming to the side effects, it is the same as I already discussed, the HMG mnemonic. And here with the drug interactions, it will interact with drugs like glycosides like digitalis, thiazides, anticoagulants, etc. And these drugs have a bad taste. That is why patients generally don't prefer to take these drugs. And also these drugs will reduce the absorption of fat-soluble vitamins. Now coming to fibrates or fibric acid derivatives. So the drugs in this class include the fibrate suffix, clofibrate, phenofibrate, bezafibrate, and gemfibrozil. And coming to the action, here it is a little different. It activates a very important enzyme, PPAR alpha. This is important, PPAR alpha, peroxisomal proliferation activation receptor alpha. So these drugs will increase the HDL levels and decrease the others, the VLDL, LDL, and triglycerides. And this is common to other drugs like the nicotinic acid and ezetimibe and the miscellaneous agents. And here a very important use with fibrates, clofibrate is used to treat type 3 hyperlipoproteinemia. Right. And next, and another side effect, one important side effect here is both fibrates and bile resins will cause cholesterol gallstones. This is important. And next, coming to niacin, that is vitamin B3, also called as nicotinic acid. Here mainly it causes some side effects like flushing, hyperglycemia, hyperuricemia, hepatotoxicity, and associated with hyperglycemia is diabetes, and one important condition in that is acanthosis nigricans, and the flushing can be reduced by aspirin administration. And the drug interactions, niacin mainly interacts with warfarin. It increases the toxicity of warfarin. And next, coming to the cholesterol absorption inhibitor. Here we have an important drug called ezetimibe. So the mechanism of ezetimibe is poorly understood, but it is known to bind to an important agent called as Niemann-Pick C1-like 1 protein. I repeat, ezetimibe is known to bind to Niemann-Pick C1-like 1 protein. And there is a low toxicity profile except for the liver function tests have to be monitored regularly for all the cholesterol lowering agents because these are highly hepatotoxic. And there are other agents, as I said, monoclonal antibodies like alirocumab and evolocumab. They are going to block PCSK9. So they are nothing but PCSK9 inhibitors. PCSK9 full form, pro-protein convertase subtilisin, subtilisin, subtilisin or kexin type 9. And another agent is omega-3 fatty acids. So that is all with the hypolipidemic drugs. So thank you so much. We'll see you in the next lesson.